Welcome, everyone. Professor Rich RN here. I am a professor of nursing in the BSN program. I'm also an NCLEX coach. So this channel has content to help you prepare for your NCLEX, review content if you're still in nursing school, or also skill videos if you're looking for that as well. Today, we're going to be covering NCLEX questions in regards to skin issues. So let's jump right in. Our first question: the nurse reinforces instructions to a group of clients regarding measures that will assist with the prevention of skin cancer. Which statement by the client indicates the need for further teaching? Okay, as we can see, the correct answer is B. I need to avoid sun exposure before 10 a.m. and after 4 p.m. So when we're looking at each of these questions, you need to develop some sort of strategy and specifically nail down what exactly are these questions asking us. This question is asking us we're providing education to clients of skin cancer. So it's education regarding that. But which statement by the client indicates the need for further teaching? Further teaching gives us the hint that we're looking for an answer that is going to be false. So we're looking for an incorrect answer out of these four. So if we look at A, I need to wear sunscreen when participating in outdoor activities. That's a true statement. They should be wearing sunscreen. So we can rule that one out. Let's jump to C. I need to wear a hat. That's opaque clothing, and sunglasses when in the sun. That's also a true statement. Those are things that we would educate this client on. D, I need to examine my body monthly for any lesions that may be suspicious. Of course, that's again another point that we'd want to emphasize with these patients when we're dealing with skin cancer. So that would again, of course, leave us with B, I need to avoid sun exposure before 10 a.m. and after 4 p.m. And that is an incorrect statement because if they're going to go out into the sun, that window before 10 a.m. and after 4 p.m. is the ideal window. They should be going out when the UV rays are the least harmful. So that would be the incorrect statement. Our next question: you are assessing a baby and notice small pimple-like protrusions on her cheeks. These protrusions are called. Correct answer is B, papules. These are freebie questions. If you get something like this on the NCLEX, you need to get it correct, right? So these are just definitions. So if you haven't watched my other video on skin disorders where we talk about all these, go ahead and view that one if you got it incorrectly. But the correct answer again is B. And B, a papule, is less than 1 centimeter. And an example would be a wart or kind of pimple-like, okay? A pustule is pus-filled vesicle. So it's a vesicle that contains fluid, specifically pus. Vesicles are also less than 1 centimeter, but they have to contain fluid for us to call it a vesicle. Those would be blisters, chicken pox, those sort of things. Macules, okay? A macule is going to be flat, non-palpable. So they're going to be like a freckle or a measles, all right? Which nursing intervention can help a client maintain healthy skin? The correct answer is A. So consuming a lot of water, being hydrated is going to keep our skin looking healthy, and it's a good way to maintain our skin. Okay, so B is incorrect because we actually would promote bathing with mild soap. That allows us to keep a lot of our natural oils and nutrients present within the skin or on the skin that some of those harsher soaps will wipe completely away. So we advise that. C, remove adhesive tape quickly from the skin. Of course, we probably ruled that one out right away because just ripping it off can cause a skin tear. D, recommend wearing tight-fitting clothing in hot weather. That's definitely not recommended. It's going to cause us more sweating, which is our natural way to cool our body. So for that to properly work, we'd want to wear loose-fitting clothing. The excessive sweat by wearing a tight-fitting clothing would become a problem because it could lead to infections as well. It could lead to potential infections. Next question. When assessing a lesion diagnosed as malignant melanoma, the nurse in charge most likely expects to note which of the following. All right, your correct answer is A, an irregular shaped lesion. So to answer this question, we want to remember when we're looking at our lesions on our bodies, abnormally, we're going to teach our patients, educate them, but also for us, the ABCDE kind of method. A stands for asymmetry and shape. Okay. B, border irregularity. C, color variation within one lesion. D, the diameter is greater than 6 millimeters. And E is evolving, changing features. So if it meets any one of those criteria, then they're at a higher risk of something. So that's what we're looking for. So if we apply that to the question, an irregular shaped lesion, well, that's A. It's asymmetrical in shape, right? We want it to be symmetry. We want it to look consistent. All right. Next, we have the nurse employed in a long-term care facility is planning the clinical assignments for the day. The nurse knows not to assign which staff member to the client with a diagnosis of herpes zoster. The correct answer is C. If you pick that one, that is correct. And unlicensed personnel who has never had chickenpox. So remember, herpes zoster is the varicose virus, chickenpox, that actually gets reactivated in one's body. And so those people who've never had chickenpox are going to be at the greatest risk of getting it. The evening nurse reviews the nursing documentation in the client's chart and notes that the day nurse has documented that the client has a stage 2 pressure ulcer in the sacral area. Which should the nurse expect to find when checking the client's sacral area? Is the correct answer. Partial thickness skin loss of the epidermis. If you did not get this one right, I recommend you watch the video that I made on pressure ulcers or pressure injuries, which we go in depth about all the 4 stages along with the unstageable. So just a quick review. Here we're looking for stage 2. Okay, so let's see if we can rule out anything from this. Intact skin. Well, intact skin is going to be found in stage 1 wounds. All right. Stage 1 is non-blanchable, but it's going to be intact. B, the presence of tunneling. Tunneling is going to be commonly found in stage 3 and stage 4. So we can rule that one out. C, a deep crater-like appearance. Deep craters kind of referred to as it's going to be a very deep wound. The deeper it goes, the more chance it's going to be to expose the muscle, fascia, the tendons, those sort of things, which are going to be common in stage 4. A partial thickness skin loss of the epidermis is something we would expect with a stage 2 pressure ulcer or pressure injury. Okay, a stage 2 pressure injury, we're going to have a partial loss of either the epidermis or possibly the dermis, but it's going to be a shallow crater-like appearance. So those kind of key words we need to be able to pull out and pick out to solve these type of NCLEX questions. All right, let's look at our final question. Which medication used below to treat systematic lupus decreases inflammation quickly, is not for long-term usage, and can lead to weight gain, susceptibility to infection, diabetes, and osteoporosis? So go ahead and look at those 4 medications and give it some quick thought on which one you might think would be the correct answer. So the correct answer is B, prednisone. All right, so prednisone is a steroid that is given short-term, and some of those side effects that it can lead to weight gain. It's going to lower the immune system, can affect osteoporosis as well. So A, that medication they actually can take throughout their lives. It's something they'd be taking daily. C, that is an immunosuppressant drug, also given to people who, got an organ transplant. Again, something that's going to be taken daily. And the last one, D, is considered a biological drug, and it's used to treat lupus. It's actually an infusion. There's initial dosing phase with this one, but once it's actually, the initial dosing phase is given, it's going to be an infusion once every 4 weeks. Well, thank you so much. That concludes our little mini NCLEX review on skin disorders and questions related to that. If there was any struggling along the way or you didn't get a perfect score, I definitely recommend that you check out some of my other videos. I hope you guys have a wonderful day.